Good afternoon, ladies and gentlemen. I'm Yoon from Korea. I'm dermatologist and medical director of the Reader's Clinic. In this session, I will tell you the changing trends and concept of Kbeauty, focusing on the forehead augmentation. It has a typical Gangnam style forehead. Her forehead looks very young, but somewhat unnatural. Too much volumes sometimes give unnatural result. This article is quoted from the Aesthetic Plastic Surgery Journal. Most Asian aesthetic patients, whether young or old, prefer to avoid surgery wherever possible, and they seek natural-looking results. Therefore, Asian physicians have had to respond to their patients' expectation, study, and then innovate procedures and management strategies to address the Asian aesthetic, including facial shape, structure, and proportion, and impact of the aging process on Asian faces. The main keyword of Kbeauty is natural looking. For natural forehead contouring, we have to check three elements. First, the surface must be even and not bumpy. Second, the central highlight of the forehead have not to be excessive. And the forehead must be smoothly connected to adjacent tissues such as nose, glabellar, and temples. I have some principle of injection for natural looking appearance. I choose small particle fillers than larger ones. I am trying to inject without empty space and evenly. These are small particles and those are larger ones. If we choose a larger particles fillers, those particles could make an uneven surface because the skin of the forehead is very thin. From now on, I will tell you some important anatomical structures when injecting fillers. As you know, scalp have the 5 layers: skin, subcutaneous fat, gallia aponeurosis, loose connective tissue, and pericranium. In the upper face, especially just above the eyes, gallia aponeurosis means the frontalis muscles, loose connective tissues or subgallia spaces are connective to path of the eyebrow, and pericranium of the scalp means the frontal bone periosteum. This picture is cadaver dissection. Take a look at the layers of the temple. Skin and subcutaneous tissue, superficial temporal fascia, and temporal pap fat, and deep temporal fascia and temporalis muscle. In the left side of the cadaver dissection, with the removal of the skin, we can see the thick subcutaneous tissue, gallia aponeurosis, and underlying frontalis muscle. And after gallia aponeurosis is reflected, the frontal muscle is seen. These are arteries of the face. And there are too many arteries of the face. These are most important arteries of the face. We have to remember these arteries, please. In the forehead, 3 major vessels are seen. First, anterior branch of the superficial temporal artery. Second, supraorbital artery. And the last, supratrochlear artery. Among them, the superficial temporal artery comes from the external carotid artery, but the others, supraorbital and supratrochlear arteries, comes from internal carotid artery. So, if we inject fillers strongly into these 2 arteries, the retrograde flow can be made. The injected fillers can go toward the ophthalmic artery. If the retinal artery is occluded, the blindness is possible. We have to inject carefully around these 2 arteries. It is important to know the pattern of these 2 arterial systems. In this article, we can see 2 arterial distribution pattern of the forehead. With the presence of the deep branch of the supratrochlear artery, the arteries divide into 2 categories. Type 1 is a deep branch of the supratrochlear artery present pattern, and type 2 is absent pattern. And type 1 is 55% and type 2 is 45%. In the type 1, there are two subtypes. For type 1A, the radius superficial to frontalis was supplied medially by the superficial branch of the supratrochlear artery and laterally by the superficial branch of the supraorbital artery. The deep branch of the supratrochlear artery and the deep branch of the supraorbital artery were distributed deep to the frontalis. For type 1B, the radius superficial to frontalis was supplied by the superficial branch of the supratrochlear artery and the superficial branch of the supraorbital artery, in addition to central artery or paracentral artery. The deep branch of the supratrochlear artery and deep branch of the supraorbital artery supplied the layer deep to the frontalis. Type 2, the layer superficial to frontalis was supplied medially by the superficial branch of the supratrochlear artery and laterally by the superficial branch of the supraorbital artery. Only the deep branch of the supraorbital artery supplied the layer deep to the frontalis. Look at the left. You can see dissected area superficial to the frontalis. Black arrow head and black arrow indicate the superficial branch of the supratrochlear artery and superficial branch of the supraorbital artery, respectively. In the center, these pictures shows dissected area deep to the frontalis. White arrow head and white arrow indicate the deep branch of the supratrochlear artery and deep branch of the supraorbital artery, respectively. In the right schematic, arterial distribution can be seen. SOF means the supraorbital foramen. These are a schematic sagittal view of the two main arterial distribution patterns of the porrid. Central views are with the skin to frontalis is retracted. Left and right views are sagittal section along the supraorbital foramen and frontal notch, respectively. As STA is the superficial branch of the supratrochlear artery, DSTA is a deep branch of the supratrochlear artery. As SOA is a superficial branch of the supraorbital artery, DSOA is deep branch of the supraorbital artery. CA is a central artery, PCA is paracentral artery. You can see the deep branch of the supratrochlear artery is present in type 1A and 1B, but absent in type 2. In type 1B, central or paracentral artery are present. In this article, authors guided injection techniques of abdominal pillars into the porrid. The entry point, bounded by the yellow box, should be under the deep branch of the supraorbital artery penetration plane and lateral to the supraorbital foramen plane. The injection should be performed medially to the medial canthus plane, dark green box, and deep to the frontalis. In this article, ultrasound sonography investigation reveals the relationship of the arteries to the facial soft tissue layers at each level of the reference point. A. Investigate the superficial and deep branches of the supraorbital artery. B. Investigate the frontal branch of the superficial temporal artery. SF is subcutaneous fatty tissue. FTM is the frontalis muscle. To avoid vascular problems, blunt cannula is better than the sharp needles, and supraperiosteal injection is recommended. The operators have to pay attention where the cannula is placed because the porrid is convex, so the cannula tip is easy to bend. I will show you the video demonstration. To inject evenly, it is important to choose pillars. Small particle pillars is better than the large ones. I used 25 gauge with 4 cm long micro cannula when injecting pillar. I made 4 entry points. 2 are located at the lateral canthal line, just above the eyebrow. The others are at the mid-frontal depression level, mid-pili line. And to remove the wrinkle, I inject the eye depression fillers very superficially with 34 gauge needle. Let's start the video demonstration. First, I made the entry point with a 25 gauge needle and I inserted 25 per centimeter microcannula into this point and advanced it towards the medial canthal area just above the eyebrow. The treatment plane is under the frontalis muscle subcutaneous supraossial layer. After injection at the first line, I change the direction of the cannula and inject the pillar with the same plane. To place pillar at the deeper plane, I lift the skin with the non-dominant left hand. With this fanning technique, I injected pillars evenly without empty spaces. I inject very slowly with the fanning technique evenly without empty space. Retrogradely. Total amount is the 0.5 cc are injected. And second entry point was made at the mid-pupillary line and mid-frontal depression level. I inserted a cannula to the deeper plane and changed the direction towards the central area. The injection plane was deeper to frontalis muscle. I was injecting the pillars retrogradely and gently. To make an even surface, the injection had to be without empty spaces. With the fanning technique, I inject pillars without empty spaces. .5 cc was injected. For a central highlight, additional pillar was injected. And I injected the upper part of the forehead. With the fanning technique, retrogradely, without empty space. I injected the central area again for the central highlight. To make a central highlight, I inject slowly, small amount, gently at the deeper plane, retrogradely. Eye depression is easy to use. And left forehead was treated with the same technique. Entry point was made 25 needles just above the lateral eyebrow. I inserted microcannula into this point at the deeper plane, and I advanced the cannula toward the medial canthal line just above the eyebrow. I squeezed the skin with my left hand to place the cannula at the deeper plane. It is a very important technique. Left hand is more important than right. I injected pillar retrogradely with the fanning technique to the deeper plane. It's the same. The pillar particles of the eye depression is very small, so it is very good to use. Another entry point was made at the mid-pupillary line. I inserted a cannula into this point and advanced towards the central area. I was injecting fillers retrogradely using the fanning technique. Using the fanning techniques helps injecting fillers without emptying spaces. The central highlight will be made. The small amount, deeper plane, retrogradely, fanning technique is the same. And total amount of the filler is 4 cc used. With the left hand, the skin, okay, yeah. I had changed cannula to 34 gauge nano needle to inject the superficially. I was injecting fillers to glabellar wrinkles with the left hand. I squeezed the skin and inject the filler very small amount of the low dermis to subdermis plane. I was injecting fillers with the same method. Left glabellar wrinkle was treating. 34 gauge nano needle is very thin and 4 mm length. It is easy to handle. It can help reduce the pain during injection. Minimal pain. Next, I was injecting the forehead wrinkles. For deep wrinkles treatment, subdermal injection may be effective. I was inserting needles vertically in this point. And at this point, I was inserting needle 45 degree. Subdermal injection after injecting fillers at the deeper part is very effective for wrinkles reduction. It is very simple and easy. These photos are before and next day. The left is before and right is the next day. The forehead augmentation was successful naturally without bruise. Wrinkles were reduced markedly without a botulinum toxin injection. This is the right side 45 degree view, and this is the left side 45 degree view. Thank you for your attention. Thank you very much.